Hey everyone, and welcome to my YouTube channel. Today is going to be a different video, but today we're going to focus on the coronavirus, the COVID-19, the massive pandemic that is affecting the entire United States and the world. Okay, I am not offering medical advice, although I am a medical doctor. Okay, what we're going to do is I've created several slides to help you along the way to deal with the COVID-19. So, first and foremost, you need to know where to find local information on the COVID-19 and local trends in the COVID-19 cases. You'll want to go to the absolute source of the best information, and that's the CDC. Okay, go to the CDC. Know the signs and symptoms. Okay, what to do if you're symptomatic. Stay at home when you're sick. Call your healthcare provider. Limit movement in the community. Limit visitors. Take steps for those at higher risk. So for the mother, the father, the grandmother, grandpa, anybody, you need to go to the CDC website for more information on how others who are greater age and have more complex medical conditions and comorbidities or increased risk of morbidity, mortality, okay? And you need to protect yourself and your family, so you need to make steps to prevent the illness in terms of staying home when you're sick, hand washing, respiratory etiquette, and so on, and we'll go over that. And you may want to create a household plan. So a plan of action in the case of illness in the household or disruption of activities of daily living due to the COVID-19. Make sure you have medications available and in supply at your home. If you do have any medical illnesses that you really need to be taking your medicine all the time, and how to get food delivered if possible. We'll go over, the typical Uber Eats, and you have your DoorDash. All right. So they're just still delivering, although the restaurants are closed. Okay. And establish plans to work away from home. All right. And what to do about childcare needs, because there are people who do have to go to work. Those in the healthcare community. There is a list, and I'm in New York State, for essential workers and non-essential workers. So if you're an essential worker, you still need to make the plans for childcare needs as well. Okay. So if you're sick or caring for someone, all right, if you're sick with COVID-19 or suspect you're infected with the virus that causes COVID-19, you should take steps to help prevent the disease from spreading to people in your home and community. That's the biggest thing, because it spread like wildfire. We're seeing now on the COVID tracker, which I'll show you right here. I'm looking at the total confirmed cases, 549,474. In this county alone, Suffolk County, we have 2,735 cases alone. Okay, and when compared to New York, there's 44,635. So this is a good place to know how rampant this disease is and how much it's spreading. And a lot has to do with the population density. Common sense. So common sense tells you, well, stay away from people, okay? Avoid things such as shaking hands, and if you're sick, don't spread your germs to others. All right, so we'll come back to that. So if you think you've been exposed to COVID-19, develop a fever or symptoms such as a cough or difficulty breathing, call your healthcare provider for medical advice. Go to cdc.gov/coronavirus, and you'll find out a lot more information there. Quarantine, 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 quarantine. What does that mean? It means getting the heck away from everybody else, okay? Stay home. Do not leave your home, okay? Because you're at risk of catching it and spreading it. Even if you do test positive and you're asymptomatic, you can spread the disease. The COVID-19 coronavirus disease. So you want to take preventative measures, all right? You want to understand your symptoms. Okay, so preventative measures include coughing into your elbow, okay, washing your hands, not high-fiving, not shaking hands, wearing a mask, not gathering with large numbers of people, and staying home. Symptoms include fever, dry cough, difficulty breathing, weakness, and there's a lot more, okay? So go to your doctor or look up on the CDC website other symptoms and signs. And stay at home and call your doctor, okay? Again, what are the symptoms? Fever, dry cough, tiredness, all right? Runny nose, sore throat, difficulty breathing, pneumonia. You have to understand that you may have contracted the disease, but there's an incubation period, and you may not be symptomatic right away. So it may take a couple of days to become symptomatic. And if you're going out and around, you know, contact with other people, you're spreading the disease. Preventive measures: washing the hands, social distancing, quarantine. Stay informed. Avoid touching your face. That's why it's good to wear a mask a lot of times, because it avoids you from touching your face. Not just using the mask for, to block any inhalants from going in, but from blocking your own self from touching your face. Throw away used tissue so it doesn't, so somebody else doesn't touch it. Sneeze into your elbow, call your doctor, and do not handshake. Elbows, not even fist pumps. So again, we're focusing on all of these common sense things. Prevention. Use hand sanitizer if there's any left. Use soap. Wash your hands in a sink, okay? And stay healthy. Vitamin C, okay? Zinc. And check out the CDC website for other recommendations as it pertains to preventative measures. The symptoms, again: fever, fatigue, cough, shortness of breath. If you develop these symptoms, make sure you call your doctor, especially if you have other comorbid conditions such as diabetes, COPD, asthma, and so on. Spread. The coronavirus is spreading like wildfire, okay? It is absolutely insane. And how do we prevent that from happening? Social distancing, quarantining, self-quarantining, and preventative measures. All the things that we have talked about. You need to stay home, wash your hands, distance yourself from others, and try and stay as healthy as you can. Avoid contact with other people. Social distancing. So they're recommending 6 feet, okay? As you can see in this schematic here, distance yourself at least 2 meters, okay? Wash your hands, soap and water. Stay away from anybody that's positive, all right? And make sure that you are just using common sense things. If you have to go to work because you're an essential worker, as mandated by the state, then still make sure you're wearing a mask. Make sure you're using all of the protective gear that you're supposed to wear. If you're a doctor or a nurse, EMT, you're wearing your gloves and your gowns. Pandemic, that's what we're experiencing now. It has grown enormous. First starting in China, then in Europe, and we've seen the cases just double, triple, quadruple, and people are getting sick, people are dying. I mean, you can see here the confirmed cases, 549,474, okay? You have the fatal cases, 24,883. All right, so that's globally. You could look at the epicenters here. So, it's just insane what it's doing here in Spain and over here in Italy. And even so, if you look at New York is huge. Total cases of 44,635. 519 deaths. I've seen young people, I've seen old people, I've seen elderly people die. It affects everybody, depending on your immune system and your other comorbid conditions that you have. So you never know, okay? And the simplest of things, measures that you take can prevent the disease from spreading. This is why it's so important to practice social distancing. We're on lockdown, okay? Nobody should be out on the streets unless you're an essential employee, healthcare worker, fireman, police, EMT, nurse, PA, NP, whatever it is. You can go to your state's website and look up and see who are the essential workers in your state. I'm showing New York here, and this was updated as of March 27, 2020. Guidance for determining whether a business enterprise is subject to a workforce reduction under recent executive orders. And you can see here the essential healthcare operations include research laboratory services, hospitals, walk-in health clinics, facilities, and so on and so forth. And it breaks it down by different types. So manufacturing, essential retail, like gas stations, obviously pet food. I mean, we're not going to let our pets die. Farmers markets, and essential services. So trash, mail, laundromats, all those sort of things. News media and financial institutions. But even if you look at the news media, you'll notice that there's usually one person or two people on the couch for the news station, separated by at least 2 meters, and they're actually at home, a lot of them. A lot of people are working from home, and they're learning how to do telework. All right, and that's the future. So, if there's one thing I can say, it's stay at home and beat the coronavirus. Again, stay at home, learn to cook online, stay at home and read a book, stay at home and do yoga, stay at home and learn online. Just stay at home and learn something new, do something new, and stay healthy. Again, you have Uber Eats, you have the Slice app, you have Grubhub and DoorDash. You have all these different apps which will bring food to you and leave them at your doorstep. Again, contact the company's website to look for information regarding the COVID-19 and how it may impact your service in that area. So again, the most important things I can say are: know what the signs and symptoms are, know the preventative measures, and know when to get help. And please, stay home. Go to the CDC website at cdc.gov/coronavirus and find out all your information there. If you have any questions or comments, please post. I'll be more than happy to get back to you on those. Again, this is not medical advice, although this is Brennan MD. And you can visit my website, ChristopherBrennanMD.com. Subscribe and share. Stay healthy.